What is compulsive gambling and how to avoid it? Compulsive gambling, also called gambling disorder, this is uncontrollable urge to keep gambling despite the toll it takes on your life. Gambling means that you are willing to risk something you value in the hope of getting something or even greater value. Gambling can stimulate the brain reward system much like drugs or alcohol can, leading to addiction. If you have a problem with compulsive gambling, you may continually chase bet that leads to losses, hide your behavior despite saving, accumulate debts, or even resort to theft or fraud to support your addiction. Compulsive gambling is a serious condition that can destroy lives. Although treating compulsive gambling can be challenging, many people who struggle with compulsive gambling have found help through professional treatment. What are the symptoms? Signs and symptoms of compulsive gambling include being preoccupied with gambling, such as constantly planning how to get more gambling money, needing to gamble with increasing amount of money to get the same thrill, trying to control, cut back, or stop gambling without success, feeling restless or irritable when you try to cut down on gambling, gambling to escape problem or relieve feeling of helplessness, guilt, anxiety, or depression, trying to get back the lost money by gambling more, chasing losses, lying to family members or other to hide extent of your gambling, jeopardizing or losing important relationship, job or school or work opportunities because of gambling, resorting to theft or fraud to get gambling money, asking other to bail you out financial trouble because you gamble money away. Unlike most casual gamblers who stop when losing a set loss limit, people with compulsive gambling problem are compelled to keep playing to recover their money, a pattern that becomes increasingly destructive over time. Some people with compulsive gambling problem may have remission where they gamble less or not at all for a period of time. However, without treatment, the remission usually isn't permanent. When to see a doctor or mental health professional. Have family member, friends, or co-worker express concern about your gambling? If so, listen to their worries because denial is always feature of the compulsive or addictive behavior. It may be difficult for you to realize that you have a problem. If you recognize you own a behavior from a list of signs and symptoms of compulsive gambling, seek professional help. What are the causes? Exactly what causes someone to gamble compulsively isn't well understood. Like many problems, compulsive gambling may result from a combination of biological, genetic, and environmental factors. What are the risk factors? Although most people who play cards wagers never develop gambling problem, certain factors are more often associated with the compulsive gambling. Mental health disorder. People who gamble compulsive often have a substance abuse problem, personality disorder, depression, or anxiety. Compulsive gambling may also associated with bipolar disorder, obsessive compulsive disorder, or attention deficit hyperactivity disorder. Age. Compulsive gambling is more common in younger and middle aged people. Gambling during childhood or teenage year increases the risk of developing compulsive gambling disorder. However, compulsive gambling in the older adult population can also be a problem. Sex. Compulsive gambling is more common in men than women. Family or friend influence. If your family member or friend have a gambling problem, the chances are greater that you will too. Medications. Medication used to treat Parkinson's disease and restless leg syndrome, drug called dopamine agonists, have the rare side effect that result in a compulsive behavior, including gambling in some people. Certain personality characteristic. Being highly competitive, a workaholic, impulsive, restless, or easily bored may increase your risk of compulsive gambling. What are the complications? Compulsive gambling can have profound, long lasting consequences for your life, such as relationship problems, financial problems, including bankruptcy, legal problems, poor work performance, poor general health, suicidal attempts. Prevention. Although there is no proven way to prevent the gambling problem, educational programs that target individual and group or increase risk may be helpful.